Hi, this is John Hawkins Jr. This is video number 2 on my series on addiction. And today I'd like to speak briefly on, is addiction a disease? Now this is a topic with probably more controversy than any other thing about addiction, I would say. My answer would be yes and no. So I hope that gives you lots of clarity on the answer there. The traditional model would say that addiction is a genetic disease that people are born with. And this goes back to all the way to the A Big Book with things like, being born with an allergy. I would say there's been debate over the last 50 to 70 years in psychology of nature versus nurture, and biology as well. What I would say, it's an interplay of the two. So it's not as simplistic, in my opinion, based on the science and then working with 1,000 clients or more. It's, I would say that the idea that somebody's just born genetically as an addict, I would totally dispel. We know now from biology of a process called epigenetics. So this really, in a most simplistic form, would say that, okay, we may have a gene, but the gene is going to go right, left, depending on the interplay with the environment. And so somebody may have different genetic codes handed down or trauma handed down neurologically, which we now know is possible in the DNA and on a cellular level, that if I grew up in a chaotic environment, nature says, well, there's probably a pretty good chance that your offspring is going to grow up in a chaotic environment. And so when that's passed down, it's going to make that person genetically coded to be more hypersensitive to stress or things like that, which can then create a higher need for their nervous system to be able to calm down. And then there's going to be a bigger difference for them the first time they use a substance than for someone else. So let's say if you look at it as a mood line, where over here I've got euphoria and over here I'm suicidal. Somewhere on this line, everybody sits. If I'm over here and the first time I smoke marijuana or have a couple drinks and it kind of does this to me, it's not such a huge life-altering event. I don't like to get too intoxicated because I feel pretty good here and I don't want to go far away from where I feel. If I'm down here for 1,000 different reasons and you take me from here to here, this is a huge shift for me now. Like, I want to stay living over here. I don't want to go back to living over here. And so when you see, and I think I spoke to this in another video, when you see certain things of people saying, well, there's a genetic, is the predominant factor because you see a family generation of addiction. I would say in almost every case, you also see a family, intergenerational handing down of trauma and lack of emotional development and ability to regulate your emotions. So then I'm going to have to grab some external compulsive behavior, just like if, many times a client says, well, I'm the only addict in my family, because they're the identified substance user. But as I look deeply into the family history, maybe their brother is a workaholic, their sister's obese, their mom compulsively spends and is up to debt to her eyeballs, but I'm the only addict in the family. And so, it's, again, not just about substances. So I would say once addiction has taken hold of the brain, it is definitely disordered and it's been hijacked. Now, for me, like anything else, you have to take a very individualized approach. There could be 50 reasons why that particular individual got more prone to using substances. Whether it was, something, the biggest thing is different types of frozen traumas in the nervous system. And probably 80% of what really the body and the brain designate as trauma, because it triggers disassociation, most people won't designate as a trauma. I can't tell you how many people I've worked with who experienced birth trauma that they would never know, but a part of them froze that trauma, and from the delivery, whether it was a cesarean or a last minute or a difficult birth, and that got encoded in the body from right out the gate. You can even be traumatized in utero, where you're getting encoding different things in memory systems physically in the body that are happening to the mother and getting flooded with adrenaline, all these kind of things, which then make it much more, prone to needing something to regulate all that energy in my nervous system. Attachment is the foundation for everything. So whoever that primary caregiver is, how they emotionally attune to the infant, how they, attune physically through the energy coming through their body. So if a parent, the primary caregiver, has trauma and they either get triggered with anxiety, the baby is going to absorb all that anxiety this is all nonverbal communication, or let's say things that maybe the caregiver had to disassociate from that were traumatic or just through neglect. So now if the infant triggers that or needs that particular response that the caregiver can't access, then there's like this sense of nothingness, which sends the infant into a panic and eventually disassociation themselves, so they don't get nerve damage in their body and brain. So it gets a little more complicated than just saying it's a disease. And there's proponents on both sides of a disease, non-disease, different models of addiction. And it almost becomes like a religion where people get their sacred cows and dogma and they plant their flag, and then they don't want to hear anything anyone else has to say who's got an opposing viewpoint, which I think is very ignorant, and one of the reasons the field hasn't progressed that much. And what, like, again, the statistics say, which can be misleading, because just because somebody relapses doesn't mean they don't eventually get sober, but that what we do could use a whole lot more improvement. And so that would be expedited if people would not be so married to their sacred cows around, one of the particular ones being it's a disease, it's not a disease. Again, I prefer to say the brain's disordered. Like, I don't think you're just born genetically as an addict and then I'm screwed. And I'm not saying that in a sense where, all right, I can repair that and go back to recreational drug use. I would not do that. But, it's a complex question. Some of the more recent models over the last couple of decades have used what they call the biopsychosocial model. So looking at the person's biology, their psychology, their social environment, spiritual elements to that, all those kind of things. And so, again, working with trauma, working with addiction, we know you really have to work and change the person's neurology. And, whether it's in some cases medication, holistically, I think you can do the majority of it to balance certain things in the brain that do have a genetic component. So for me, the truth on almost everything is always in the middle. So to say disease, no disease, nature, nurture is going to be on one end of the polarity and miss a lot of the picture. So I think if more people were open-minded and really looked at what everything has to offer, whether it's this model therapy, 12 steps, holistic medicine, all these kind of things, because overcoming addiction is a really difficult process. And I think you need every help you can get, everything you can get your hands on. It can be a real street fight. So that's my answer to whether addiction is a disease. Yes and no. It definitely is a disorder of the brain where the brain gets hijacked. And there can be things that make you more vulnerable than somebody else, but it's not going to happen outside of an environmental relational context. And so to heal, you have to factor in all those pieces. So you can't just say, well, let's give this medication and that'll cure the person, or not address chemical imbalances in the brain. But even a chemical imbalance is never that simple. It doesn't exist in isolation. I know insurance companies and different things would like it to be that simple. I mean, they're really pushing pharmacological interventions, and I'm all about dealing with the brain and the nervous system and things like that, but you have to take a really holistic view of the process of addiction, but then very individualistic treatment plan for each single person. So I would value any feedbacks, agree, disagree on today's topic of is addiction disease or not. I hope that's opened a few people's minds and maybe give you something to think about. And I look forward to hearing from your comments and putting out the next video, number 3.